Hey everyone, welcome back to the Neuro Health broadcast. This is your host, Dr. Joe, and today we are talking with Dr. Halie Elchos about neurodysregulation and functional medicine. Dr. Halie is going to talk about a lot of interesting things that can lead to dysregulation in the nervous system, such as parasites or mold or even emotional trauma. And she's going to talk about all the unique ways that she's able to address these things and restore proper neurological function. So, after a quick announcement, Dr. Halie Elchos and neurodysregulation and functional medicine. This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the Neuro Health broadcast. I'm your host, Dr. Joe, and today we are joined by our guest, Dr. Halie Elchos. Thank you for joining us today.
Thanks for having me, Dr. Joe.
Of course. And today I'm excited to talk about the topic dysregulation in the nervous system from a functional medicine approach. So this is a hugely important topic, and you're wildly informed on this topic, and you see a lot of patients within this realm, and this is going to cross over perfectly with our listeners. So this is great.
Awesome. I'm excited to be here.
So before we dive into the topic, just tell us a little bit about yourself and how you got interested in working with the nervous system and what brought you down this route of healthcare.
Sure. I would say, as far as how I even got to chiropractic in general, I grew up, I was lucky enough that my parents took me to a chiropractor and being an athlete and things like that, like I just could see the improvements on my overall body. And I was just like, out of high school, I was like, I want to be a chiropractor. I didn't really have quite an understanding of what that meant. I just know that non-invasively, they made me feel better. And so after pursuing that, and after learning the philosophy and things like that that go with chiropractic, that the body is perfectly created and if it's given what it needs, then it can heal itself. And that's just on even from a belief standpoint, like that's just something that really, yeah, went with it, just a lot of integrity in that. And what better way to like help people than to facilitate their healing like on their own. And so um yeah, I and then once getting into that and changing my lifestyles, right, in chiropractic school, we start learning all these things, and you begin to start eating better and treating your body better, and you start realizing, wow, like all these things actually do make a difference in your life. Going into practice, whenever I first came out of school, I was at a personal injury clinic, and I was helping people, I was adjusting people, but the thing is, like, I was spending 5 minutes with a patient. They were mostly pain based, and I just started realizing, wow, like people need more, and no one else is really going to provide that. No conventional medicine is going to provide that. And so I really went ahead and took some steps forward in getting learning functional medicine, mastering that, spending time with other functional medicine practitioners, and learning how they're treating patients, and really just getting to the underlying root of that inflammation. Chiropractic adjustments are amazing. I've seen miracles with that. However, whenever our patients are having some type of internal stimulus or external stimulus that's wreaking havoc on their nervous system, that those things also need to be addressed.
Yeah. And I love that, just like myself, started as a chiropractor, because of the philosophy of, you want to get to the root cause of somebody's illness and discomfort and disease, right? And, chiropractic is a huge part of that. And that kind of opens up the doors to so many other avenues of healthcare too, like diet, like, important supplementations, lifestyle changes. And, that kind of seems like led the way for you to get to where you are now and really mastering this kind of complex field of healthcare, so that you're able to help people who are struggling with complex issues, right?
Yeah. Yeah, it's been disheartening just seeing people going from practitioner to practitioner to practitioner, not getting like the help that they actually need. And so that's really what made me just deep dive and wanted to actually help people heal, truthfully, and and just keep digging deeper and deeper into that, because you do have your individuals. I don't know, you probably have patients that come in all the time. They're like, oh, I have the perfect diet. I eat keto. I exercise every day. I'm doing this, I'm doing this. And they're like, I'm still not having the results that I want. And so that's when we, as practitioners, we have to ask the question, okay, does this person have some type of internal resistance that is wreaking havoc on their nervous system, right? Is this person battling with mold toxicity, parasites, heavy metals, or is it an external stimulus? Is this person, in a bad relationship that is hard on their nervous system? Is this person not living like true to their self? Those are huge, huge markers in an individual's health that aren't just necessarily like physically, what am I doing every single day? And sometimes I'm sure that you see it in practice a lot when trying to help individuals and they're like, I'm doing all the right things, yet I'm still having these symptoms.
Mhm. So, so you mentioned a few things there, like mold, parasites, and even emotional distress as well. How do you go about, I mean, those can be very different, right? And I assume your testing will be very different and
Yeah.
your approach will be very different for someone who's dealing with an emotional issue versus a parasite, right? So how in your practice do you just start by approaching that patient? What does your intake look like? Things like that.
Yeah, absolutely. So my intake is very in depth and really and truly by the time a patient finishes that, I can probably pinpoint what's going on with them. However, we do testing, and that's something that's pretty special and individualized to what I do. I do what's called frequency medicine. Again, as a functional medicine practitioner, as far as like integrity goes, like right out the gate, gosh, you're having to do $2,000 worth of blood work and mold testing and parasite testing and just trying to figure out what the problem is. And I do hair analysis, epigenetic hair analysis in my office, which essentially is frequency medicine. And it's actually going to tell me if a patient has parasites, mold, toxic metals. It also tells me a lot of their nutritional deficiencies. And through looking at those nutritional deficiencies as well, you just start putting pieces together as to like what's truly going on in their system. And so, first and foremost, our job, even as a chiropractor, right, we're trying to relieve the body of stress. So in any instance, anyone I'm treating, no matter what they're dealing with, that's always the first approach. It's actually, okay, how do we take this stress off your system? And so for me, that is going to be addressing their detoxification in their body, making sure that our liver drainage pathways are open, making sure we're detoxing appropriately before I go do anything specific for parasite cleansing or heavy metal cleansing, mold cleansing. If they do have emotional dysregulation, what I do essentially is I make them aware of it. I talk to them about it and just say, hey, like whatever external stimuli you can take out of your life, um, I really encourage you to do that, right? I talk to patients about we all have a threshold, and healthy people are living here. That means I can eat the gluten, I can go into a stressful environment and not be thrown out of control. Right. But then if you have patients that have quite a bit of resistance on their system, they're living right at their threshold. So that means when your patient that does eat the clean diet, does they eat the gluten and it creates all these issues in their life, that's because they're just living at your threshold. And so my objective is to get people living below their threshold, right? Let's go ahead and open your drainage pathways. Let's go ahead and get you on a good diet. Let's practice getting out in nature and not spending so much time on our phones, right? So objectively, we want them to be living below that threshold so they're not so susceptible to that havoc being wreaked on their system. They're not so susceptible. They can eat the gluten every once in a while, right? And be okay. Because again, that's another stressor. So many patients come in and they can't even go enjoy dinner with their husband because they're having to ask the restaurant, like, what oils do you use? What what's in the food? Do you have gluten? Is it prepared in a gluten-free kitchen? And so being able to give people just their life back is rewarding. Just those little things. Like, are they completely healed all the time? No, but can they go enjoy dinner with their husband? Absolutely. And so that's really what we're trying to do here, right? We're trying to relieve people's bodies of resistance so then their body can self-heal on its own.
Hmm. Yeah, lower that amount of water in that proverbial stress bucket, and allow them to take on more stresses of life because that's inevitable. We don't live in a perfect world, so if you can lower that threshold, or not lower the threshold, but lower kind of where they're living below that
Mhm.
threshold, that's great. You had mentioned doing hair analysis in your practice. So that's probably something that might be a little novel or unique to some of our listeners. Can you talk about what it is that you're doing with that testing?
Sure. Yeah. So it's from Cell Wellbeing, and it's based off of frequency medicine. So essentially, everything gives off frequency, right? Our cell phones, our computers, and so do we as individuals. And all that information is actually held in our hair follicle. And so what I have in my office, you can also do mail-in kits. But what I have is a device and it has coils in it. And I place the hair on the coils. And what it's doing is it's going to be detecting frequencies. It sends it into the computer, and in 15 minutes, it generates a 35-page report specific to that patient. And so that's another like a big thing. In that moment on a patient's first visit, I can help them versus with any other type of urine test, Dutch hormone test. You have to wait 2, 3, 4 weeks to get the results back to start that patient under care. And with this, and like I said, 15, 30 minutes, we have the patient um, a plan, or at least they have an idea of what's going on inside of their body. And so it's really been a game changer for me as a practitioner, especially mentioning earlier, just like the cost up front with blood work and all those other testings. That's $1,200 to $2,000, and here we're really able to make it a lot more affordable for patients.
Yeah. And have you found that it's been a pretty good replacement for those tests? Like if you do the
Yes.
test and you do that, they pretty much say the
Yes.
same thing.
Yeah, and so in a lot of instances, like, oh, I love that. I love when patients go out and they bring in blood work, and then like the hair scan report says like the exact same things of what they may be lacking in their system. And so in some cases, especially maybe workman comp cases or things like that, a patient's coming in, mold comes up, right? And I'm like, hey, are you exposed to mold anywhere? And like, oh my goodness, yes. And like they show me their office and stuff like that. And I'm like, well, and they want to maybe try to get some of their care taken care, reimbursed or taken care of. And I say, hey, like odds are medical community, they're probably not going to take this as like um results per se. So why don't we go ahead and buy a urine analysis test? And yeah, 100% of the time they're accurate.
Hmm. That's awesome.
Yeah.
That's huge, especially if it's that accurate and that quick and that informative. Like that's, like you said, game changing.
There's no other report out there that you can find out all of your vitamin markers, your antioxidant markers, your amino acid markers that I know of. There's no other testing out there that can do all that. Plus, show me your resistant markers as well as food sensitivities.
Mhm. Now, I know you're a very curious person, so I'm sure you've done this on yourself, right?
Oh, 1,000. Yeah, I do it. So I do it every 3 months.
Hmm.
And so that's kind of what it's like. It's we're always changing, right? Our epigenetics are always changing based on our environment. And so this is really the premise behind the technology. This technology is highly used. It's actually a German company. It's highly used in Germany. I actually learned about it from an Australian MD naturopath. He was using it down in Ocala, and I had gone and learned from him. And so it's highly used in other countries,
Mhm.
just not here. But yeah, that's the premise behind it. It's like every 90 days, our body's adapting to its environment. And so yes, I'll test myself every 90 days just to see where I'm at. I always want to be at the optimum health as well. And
Mhm.
so I try to utilize that as a tool. So
That's awesome.
absolutely.
That's
Yeah.
great.
Oh yeah.
So some of the common things that come up, it sounds like you mentioned parasite and mold and things like that. How might those approaches of the treatments differ in those different things?
Yeah, yeah. So I actually always get excited whenever like parasites come up for someone because for me that's it's an easy fix. It's giving me a context of okay, this is what's going on, and it's a pretty like easy fix. And so I mostly use a company called Cellcore, and I use a lot of their supplementation, mostly because they've proven to be the best. I've never you really use any other supplements that I was like, okay, I see a noticeable difference like I do with Cellcore.
Mhm.
And so for that, what I usually do, like I said, I'll always 100% of the time, I'm going to detox my patients first or open their drainage pathways. I need to make sure that those drainage pathways are open before we go doing kill off of any type of parasitic infections. I think a lot of times people detox and their drainage pathways aren't open, and that creates that Herx reaction, right? That creates the dizziness, the vertigo, the sick to your stomach, and then patients really have difficulty being compliant. And so, starting with that liver detoxification first really allows for patients compliancy moving forward. And so, yeah, for parasites, depending on the situation, some people are much more, I don't want to use the word infested, but I guess patients have a lot more parasites than others. And so it's usually, I kind of always go by what they're expelling. Still, it's usually 30-day increments, right? And so I'll have them do a 30-day parasitic cleanse using the cell core. And just depending on where they're at, hey, like at the end of that, are you still like seeing things in your stool, asking those types of questions, and that will kind of dictate what we do moving forward after that.
Mhm.
Mold looks a little different just because it's not necessarily parasites. They do get in our tissues and things like that, but mold it's a bit more of a difficulty with the detox process because I'm then asking patients to go consider getting a membership at a sauna to sweat to detox or taking really hot baths for those things. But I still use a company called Cellcore, and they have some mold specific protocols that we use. Um, and I would say, really and truly, heavy metals has probably been the most difficult. As you probably know, heavy metals they can cross the blood-brain barrier,
Mhm.
and so it's usually a more intensive type of detoxification process. And a lot of times, patients will actually have pretty bad breakouts on their skin. Those heavy metals actually trying to pull through the skin.
Gotcha. Yeah, heavy metals can just wreak havoc on the brain, and mold can wreak havoc, and parasites can wreak havoc too. It's nice that one's easier to treat than the other, I guess, or one's at least easy to treat, more or less with the parasites. But in considering parasites, we've talked a bit about mold on this podcast, a little bit about heavy metals. Parasites, I don't think we've gone into too much. So when it comes to, I guess, parasites in the environment, what should people be aware of? And how might someone know if they had a parasite?
Yeah, so Joe, what like through this process, this again, like as a practitioner, right, you start picking up patterns in people. And so I've been trying to figure out like why are some patients more parasitic than others? Why are some patients yeah, just overloaded with them versus someone else? And that really um I'll go back to the nervous system aspect, but like I always notice a pattern. Like those patients are always the one that come in like a little frazzled. They're like, I've tried everything. But in that, I'm saying, okay, what else is taxing their nervous system? And I've started testing my patients for EBV, Epstein-Barr virus, and about 100% of the time they're coming in and their Epstein-Barr virus is very high. So what is that telling me? That's telling me that their immune system isn't able to take care of the parasites, right? So their immunity is already down, and that's when that parasitic infection is starting to kind of take over and invade.
Mm-hmm.
So then it's a matter of, okay, if we're taking care of the parasites, we also need to make sure on the back end, we're getting this patient on a long-term natural antiviral to keep their immunity up so that parasitic infection just doesn't come back. As far as like our environment, I don't think we're all just vulnerable to parasitic infections, right? I think it's where our immunity is. That's what makes us more vulnerable, or where we are on our threshold bucket, right? That's what makes us more vulnerable to that. Obviously, we know, traveling to other countries, drinking other food sources, things like that. But even your pets, people with pets, especially living inside, you're probably going to have parasites, or you'll be exposed to them. I shouldn't say you'll probably have parasites, because if you have a healthy immune system, I think it's going to take care of it, right? Swimming in um, lakes, ocean, springs here in Florida, all those things will leave you a little bit vulnerable to those parasites. And so
Mm-hmm.
having a healthy gut microbiome is very important for patients, getting rid of any resistance, keeping their immunity up, all those things in any realm of sickness or disease. It's going to, take care of any resistance on our body, right? We're our bodies are self-healing. That's been established. Sometimes they need a little help, but if we're keeping our immunity up, if we're keeping the resistance down, then the body's going to take care of everything.
Mm-hmm. Right. And one of those things that might lead to immune suppression could be external stressors, right? Our
Correct.
environment. I know we mentioned kind of the internal and then the external stressors that you like to consider when it comes to neurological dysregulation. So, how do you then approach those external stressors, right? Like someone's in a bad relationship, somebody's got some kind of struggle in life they're going through. How do you do that without, I guess, crossing into psychology and things like that?
Oof. I don't know if I don't cross into psychology. I don't know. I think that as a practitioner, if you have the time and space, like I like to provide a space for patients to process, but obviously I'm not a therapist. I do encourage my patients to seek out therapy. I also there's something called the emotion code, which is very helpful for patients. So I always encourage them. I have a practitioner I refer them to. I refer them to cranio sacral therapy, right? Helping to regulate that nervous system, helping patients to come back into their body. So many are not aware of that, and so helping them come back, giving them vagal stimulation, breathing exercises, right? Things that stimulate that vagus nerve to help them get into that state of rest. But I really think awareness is the key, and things I try to bring to their attention. And it's not that I don't want to say it's not that we can't deal with the bad external stimulus, right? Or the external toxins. It's just that what else is building up on that system to make us a little bit less resilient. And again, always encouraging patients for the normal chemicals and hydrocarbons that are in our environment, right? We live in a toxic environment. It just is what it is. And really and truly, I take a liver support every single day to allow me to deal with my external environment as best as it can. We can't outrun our environment at this point. The only thing we can do is take the best care of our host, and that's just what I try to do. That's what I try to encourage my patients to do. So making a bunch of the little switches in their life, encourage them to go seek some type of emotional help, teaching them how to regulate their nervous system on their own, bringing awareness into their body, and and yeah, just encourage them to get out in nature, get grounded, stop being on the phones, get into a good sleep routine,
Mhm.
all the little things that really add up in the long run.
Yeah, and I think the way you said you like to take care of the host, right? And I think that kind of highlights one of the key differentiators between maybe our model versus a traditional model, right? Our job typically is to get the person in front of us as capable to handle their environment as possible. Whereas, maybe the traditional medical model might be worried about kind of taking care of, I don't know how to say this, but more so fixing the environment for the person, right? Rather than allowing the person to adapt to the environment.
Right
Does that make
there.
sense?
Yes, 1000. Yeah, of course, one thousand
Yeah.
percent. And that's where the conventional model has certainly missed it in the event of just having the understanding. And that's what makes chiropractic different. And if anyone gets anything out of this, just understanding that that's what the philosophy is what makes it different. Our way of thinking and treating patients is what makes it different, right? We're always trying to say like, hey, what can we relieve off of our patients so that their body can adapt to its environment a little bit better? And there's, yeah, there are no other doctors that are going to treat a patient like that.
Hmm. Yeah. Well, the world is lucky that it has practitioners like you in it that
Mm.
think outside the box and practice in this way. So, we really appreciate that and you coming on and sharing your knowledge and insight with us. But before we sign out for today, could you let our listeners know a little bit about how they can find you, how they can find your practice, learn more about what it is you do?
Yeah, absolutely. And thank you so much for having me on, Joe. I really appreciate it, truly. And I'm a little bit incognito on social media. One day I'll do better, but I try to protect my nervous system
Mhm.
too. So yeah, you can find me at drhalie.com, DRHALIE. I do discovery calls with patients. If you're thinking about, wanting to do something, or if you think that I can help in any way, the website also has tons of information, blogs, things like that. If you have any, health concerns, I'd love to help you.
Awesome. And do you work with patients remotely?
I do work with patients remotely, and so you
Perfect.
don't necessarily have to live here. I have lots of patients in, Indiana actually, and California, and all that good stuff, and just from friends that are practitioners referring to me. But absolutely, so in the office I have the hair scan. However, there are kits that I can actually just mail to you. Um, Mail to you the packaging is already pre-labeled and everything. All you have to do is send me some hair follicles, and in about 3 or 4 days, I will have your report, and we'll jump on a Zoom call, go over it. And what I do is I always suggest like a 90-day protocol take home to help you get started in your steps moving forward.
Awesome. Awesome. Great resource. Well, thank you, Dr. Elkos. This has been fantastic. I'm really excited to get this one out there and yeah, hope people get a lot of value out of it.
Yeah, appreciate you, sir. Thank you so much.
Awesome. All right. Well, we'll talk to you soon and everyone else, take care.